right. Well, thank you all so much for attending today's session. It's been an energizing event so far. What we're going to be covering here right before lunch, I'm glad it's before lunch, right? So you're not sleepy. We'll give you something to think about during lunch. It's portfolio to pipeline. And it's this idea of how do you go from just one product to the portfolio sell, and how do you do that quarter over quarter to have success? And so let's start with introductions. I want to start off by Caitlin. Go ahead and kick us off.
Hi, everyone. Caitlin Mayer. I lead the U.S. marketing organization for Medtronic's Acute Care and Monitoring division. We offer respiratory and perioperative monitoring solutions that span across the hospital as well as post-acute. We also offer digital and connected health solutions. I've been with Medtronic for 15 years, always very much focused in on marketing, public relations, integrated marketing, and now I've really found where I love to be, which is very much downstream, working with our field organization and closer to customers. So happy to be talking about go-to-market strategies today.
And I'm Saul Marquez, CEO of Outcomes Rocket. Been in Medtech for just under 20 years. Medtronic, Stryker, NuVasive, either sales and marketing. And really excited to be covering this very important topic with Caitlin and for this room. All right, so we did a survey of 511 B2B go-to-market experts. And what we found is that 37% of marketers that focus on go-to-market have a revenue discipline. That leaves 63% that don't. A lot of the efforts that happen are disjointed, and that's where the big opportunity is in driving a revenue discipline. We had Heather Knight talk about that operating machine, and this is exactly what she was talking about. And so we do some really great work with Caitlin and her team, and I want to talk about that revenue discipline. Talk to us about how to go just from launch to launch to actually full portfolio.
Yeah. I think approaching a customer and really a go-to-market strategy at a portfolio level is the only way that you can move from being a Medtech vendor to being a true partner. You know, our customers talk to us about problems that are complex. They're still dealing with staffing shortages, working on improving overall throughput with really limited access to any sort of capital budgets in a lot of instances. And so we want to make sure that we come to our customers with holistic solutions. So it's not just our products, our individual devices, but we've built out a whole portfolio of services that really help us add additional value to customers. One example of that is super simple, but it's taken off. We have a service offering that's really targeted to help biomeds unbox, set up their monitors. There's shortages across the hospital. Obviously, we have IT services and education, but when you come to a customer with that holistic service and portfolio offering, then the conversation is less binary. You come with a thing to address a problem, that thing may or may not hit. When you come with a solution offering, then you leave the conversation open to continue to figure out ways that you can help your customers. The other thing that our team has talked about quite a bit is clinical value is kind of table stakes, right? We all have to go through the FDA process. And so thinking about ways that you can offer workflow value, economic value, that's what's really going to differentiate us and make sure that customers are going to get the most out of the investments that they make. And one other piece, so Saul's team and my team partnered, and he'll talk about it a little bit more, specifically on the ambulatory surgery center space. Talk about an area of care where you need to offer workflow efficiencies. They're so focused on overall patient throughput. And so you need to not just go in there with an individual device, but really thinking about how to integrate the technologies into their workflows and make sure that they're getting the most efficient outcomes possible.
So what we want to leave you with is a framework, right? If you can leave today with a framework with how you can approach the portfolio inside of the market that you're getting after, it's a win, right? And it starts with listening to the customer. And I really love just listening to Heather today in the morning session, because a lot of what she was saying, we're echoing here in today's session. When we did this research with Caitlin and her team on the ASC space, customers weren't asking for another story. We're talking to leaders at USPI, at SCA, at AmSurg, HCA. What is exactly the need? And a lot of what came up to the top is what Caitlin and her team ended up executing on the portfolio level. And Caitlin, talk to us about kind of what happened as a result of that.
Yeah. So the work that we did with Saul's team really helped inform our holistic go-to-market strategy, starting first with positioning, like I just mentioned. We're not going to lead always with clinical value. That, of course, is super important regardless of the space. We're all in healthcare, but really making sure that we're focused in on that workflow aspect, and the economic aspect is super important in ASCs. So first, how we positioned our overall portfolio. The second was targeting. So the last stat that I saw in ASCs is there's 6,500 ASCs in the US. We have a couple hundred sellers. And so there was no way that we could even take a crack at this market without getting very, very targeted and focused on a procedure level, but also thinking about how you segment the ASC market. And so specifically, we're targeting mid-size physician-led ASCs because they have more purchasing power and they can move a lot quicker. So that's where we're focused in terms of our overall targeting. And then our go-to-market strategies in partnership with Outcomes Rocket, we're going broader but very educational. So rolling out podcasts, talking about challenges that they're facing in the ASCs, webinars, of course, digital marketing, and then creating marketing resources that our inside sales team can launch from their homes out to the market. So overall, the research that we did in the collaboration with Saul helped us shape a go-to-market strategy that's led to, we aren't going to talk about this, but I'll throw it in. We had 19% growth in this space last year. So it's an effective strategy. We've been doing really well, thanks to Lindsay Alexander on my team, who may see this recording. So nice work, Lindsay. One last thing, if I may.
Yeah, please.
The other thing with this ASC space is, and I'm sure you're all familiar, it is evolving every month. Just in January, the CMS Center for Medicaid and Medicare Services added 500 new covered procedures to ASCs. And these procedures are complex cardiac procedures, ortho procedures. And so the need for more advanced technology is going to continue to expand, and our go-to-market strategy is going to need to continue to evolve as this market evolves.
Yeah, thanks, Caitlin. And it's been impressive to see Caitlin and her team do what they've done with the insights and then go to market with it. The procedures that continue to shift, we're starting to see the same needs, right? The needs that you see in the hospital, the acute needs, actually are increasing because of the number of procedures being done that are more complex. So it's really great to see the team shine there. Thinking about some of the things that arose from the insights, we had operational and cost effectiveness, HCP satisfaction, with the decreased number of anesthesiologists, keeping them happy was a big thing. Going beyond the product, outcomes, these are all things that came up to help shape the portfolio. Caitlin, back to that, a different stat, 30% of companies say sales, marketing, product, and customer service are not well aligned. And if you add clinical in Medtech, it gets even worse. Talk to us about how you sing from the same hymn sheet.
Yeah, I can feel that statement for sure. Working at Medtronic, gigantic organization, very matrixed. And so we had to make a very focused effort to drive that alignment. And the way that we've approached that is several years ago, we changed our fiscal year planning approach. And so in the past, we really developed marketing plans. The marketing team created a plan, and this is our strategy. We rolled it out to the team. We took a step back from that and said, we're not having that big of an impact. And there's a lot of different groups that touch our customers. So how can we think about this differently? And so when we kick off fiscal year planning, it is absolutely cross-functional, bringing together marketing leads. We've got strong marketing leaders across the organization. Marketing leads the conversation, but our sales team is part of it. Med affairs, clinical, training. And step number one is really reflection. So the team comes together and takes a look at some of our performance metrics. Marketing brings to the table, our overall revenue growth, our market share trends, our ASP trends, any sort of market research. Then Med Ed brings in, what's going on with new guidelines or society partnerships. Sales brings in new customer insights. And the team really sits down and through that analysis says, what's the one thing, and this is really hard for a team to do, but next fiscal year, what is the one thing that we really want to shape or impact? And the team, hashes that out and gets to a place where it's one key metric that we want to drive. Of course, there's times where it's revenue, right? Top line revenue growth, where we support the sales team. Other times it might be we want to slow overall market share decline. And so it's looking at average daily sales. But the bottom line is, regardless, we stack hands on what's the one thing this fiscal year that all of us are working towards. And we do it during the fiscal year because then you can align incentives. So this influences our sales team's quotas. This is written into all of the different groups' HR goals for the year. And I think that's what really makes it impactful. Everyone's working towards something greater than their individual job. And of course, people write out their specific tactics that are going to drive to that goal. But I think it's what inspires people, right? You're working towards something bigger than your day-to-day. That's worked really well for us. But again, the trickiest part is what's that thing to focus on? And you don't always get it right. But I think if you're working towards one thing together, that's when you're going to have an impact.
Yeah, and it's made a big difference just having that same message. One of the questions that we asked in the interviews that we did for the insights was, where do you get your information from? And we that's why we started focusing on podcasts and webinars with clinical studies inside of conference panels. These are some of the things that came out of that, and just being able to have that one view and be able to communicate it across those different channels has really made a difference. As we think about all of the things that Caitlin mentioned, just staying on that single page is the biggest thing that you could do in order to go from portfolio to pipeline. We love frameworks. As a market research agency and marketing execution agency, we love frameworks. They make a big difference. And this is what we wanted to leave you with, right? We wanted to leave you with a framework that you could take home. Have that view to be able to tell that unified story. So have that view for the unified story. It makes a huge difference. Number one, that portfolio alignment is critical. And ultimately, number three, being able to know when your team internally can execute and when a partner can help you accelerate. It's been a lot of fun working with Caitlin and her team. And Caitlin, I don't know how you would close the session out. What thoughts would you leave them with?
Yeah, I think the biggest one for me, the biggest learning over the last few years is having that singular focus and aligned incentives. That's the way that you can have the biggest impact to your business and ultimately to your customers and patients.
So that's all we have for you guys today. Open for Q&A if there is any.
So I'm interested in the unboxing that you talked about in terms of the services that extend the value as well too. Can you talk about what the insights were that led to that and why that became a central focus for your business?
Yeah. So we stood up a professional services organization about 10 years ago because we had a remote monitoring solution. And so we needed to be able to do those implementations. What we recognized was that this was a really high margin part of our business, valuable to our customers. And so we evolved it really coming out of COVID when we recognized that it wasn't just clinical staff that was having challenges. It was biomed, it was IT. And so thinking about service offerings, and we're creating them based on customer need all the time. But how can we be that holistic solution partner? And it's our products paired with those services to make sure that they get the additional value or the true value out of those offerings. So it's continuing to evolve.
Hi. So you spoke about not leading with the clinical outcomes always, and not in certain situations, right? And leading with the workflow impact, the patient throughput. Yep. And if you were to take that a step further from not just the go-to-market approach, does that then inform how you go back and looking at R&D and next-gen products and using that as part of the continuum?
Yes. So our R&D team absolutely has that in the front of their mind. So we talk about, of course, how can we continue to advance our technologies clinically, but how can we make them smarter? How can we make sure that they can easily be integrated into a hospital system? Our R&D leader talks about, get more value from the investments you've already made. These hospitals, as everyone knows, they're tight on their overall budgets. And so thinking about our development pipelines through that lens has also been something that's evolved. Absolutely.
How do you make sure that marketing stays in on the ground floor of R&D? Because sometimes what will happen is marketing will make a plan on the front end.
Yeah.
R&D will go away, they'll make it, they'll bring it back, and then marketing argues about whether or not they met the claims and then have to somehow take it forward and sell it. How do you make sure that marketing is fully engaged throughout the whole process?
Yeah, I'm not going to pretend that we've nailed this yet. It is an ongoing, struggle's not the right word, challenge. But our R&D teams so it kind of goes both ways, right? Just last week, we had a customer who was having some challenges, and we've actually set up within our R&D organization a group that is responsible for going direct to customers. So we bring in those folks along with our upstream teams to really understand and address any sort of challenges. We also execute voice of customer at several levels. So our R&D team will really think about it through that human factors piece. And then our upstream team looks at it through, the market need. And those things holistically are what comes together that actually gets back to the workflow piece, the human factors. Those things are what come together to create our overall solution. So I don't think I answered your question. I don't know that it's ever going to be, perfectly aligned. But that's the way that we've approached it.
Sure. And one comment to that one, right after an insights project, a key thing that we have to do is communicate it across all the channels. So and that's one thing that could sometimes fall apart. You keep it inside of marketing and you don't share it with the other teams, Med Affairs, communications. And so making sure that you're communicating what the findings were across the different channels makes a big difference.
Well, I'd just love to hear a little bit more about just the way the space, my gosh, MedTech, it's changed so much versus 23 years ago, it's just we've got cool tech, we're building it. There's going to be, role for it. It sounds like things have just gotten so much more, complicated and interesting now. And it just sounds like you're really helping to come in to help prioritize and get a much more targeted approach to that. Am I hearing that correctly?
Yeah, for sure. And at the end of the day, the market is the market is shifting, and Caitlin and her team, all the medical device companies, some of the smartest people in the world, right, at these businesses. And sometimes you could get a little close to the work. And so being able to take a step back and take a look at the market as well as the landscape does help. And once you see, I always tell a story of when we went to Maui, and it was February, and we wanted to see whales. And my wife and I were walking around, and we couldn't see whales anywhere. So we got on this cruise, and they took us around, and they told us what to look at. The flip of the flipper, the little spouting of the water. And I kid you not, after that little 2-hour trip, I saw whales everywhere. They were everywhere. And oftentimes it's having somebody that's not as close to the work come in and help you see it. And then the team is so good that they just take off with it. And that's the most fun part of being able to do the type of work that we do.